Pledge of allegiance. Pledge allegiance
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Too bad some people on TV can see, but.
I'll call the roll. And on my list, the first one up is Kim, and I just wanted to let everybody know that I've been texting with her back and forth. She fell several, remember she wasn't here last month, and she fell several times and was really and come to find out, she broke both her feet.
Oh.
And so she showed me a picture, and it's, she's got one of those things on both feet. And so sure enough, she was in the hospital for a little while and she's now in rehab. So certainly has an excused absence for tonight. Glenn?
Here.
Jessica? Here. Mark?
Here.
Crystal? Here. Gail?
Here.
Beth? Here. I'm here. Marcia? Here. Here. Deb? And I didn't hear anything about Karen, did you? No. Okay. Is there anyone from the public who wishes to address the board on agenda items only tonight? Anybody online? Yeah, we'll move on. Does anyone wish to add or change the agenda? If not, may I have a motion to approve the agenda as presented?
I move to approve the agenda as presented.
Support?
Support.
Support? Any discussion? All in favor say yes.
Yes.
Opposed? Motion carried. Does anyone wish to remove any of the items under the consent agenda in order to discuss them individually? Remember, we do have the special meeting, the closed session meeting minutes as well, that we'll need to turn back in tonight after we've reviewed them and approved them.
Make a motion to approve the consent agenda as written.
Support? Support. Support by Jessica. Any discussion? All in favor say yes.
Yes.
Yeah. Opposed? Motion carried. Jane, would you give us a report from your, for today? Oh. Well, just
Separate motion. Separate.
I thought it was all under the consent.
No, it is.
Is 6B part of the consent? It should be done separately.
It's a separate motion under the.
It's under the, okay. Can I have a motion to approve the closed session agenda? What's that go? Okay,
Support.
support. Any discussion? Anybody find a typo or anything in it? Okay. All in favor say yes.
Yes.
Opposed? Motion carried. Now, Jane.
Okay. So we had one program presentation for tonight. John Eagle presented for us in the absence of Charlie Wilkinson. He presented on supportive employment services. They assist in finding employment while providing their clients support. John indicated that if people have the right supports in place, that people can be employable. The goal for employment services is to have them fully integrated into the work setting. Charlie has a caseload of 40. So he's pretty tight with his caseload. There's not a lot of other things he can do, as an outreach to many employers because he has, such a full caseload. And they do work collaboratively with MRS, helping find employment as well. We also did have an update from Jenna, which is in pages 15 through 19 in our packet. And then we had an update by Diane Bennett, which is included in pages 20 through 22 in our packet. That's it.
Right. Any questions for Jane? I think I remember from when Charlie gave the report last time that it was about 40 people and he's a team of one. And so that's quite a caseload for him. Okay. Beth, will you please give us a report from today's finance committee?
Okay, starting on page 6, and this report is based through August 31st of this year. Under finance, it looks like 1.27 million will go back to the LRE. And at this time, there's $0 going back to NDHHS. On to human resources, they're still working on policy reviews, specifically the dress code and workforce development. They have a framework for leadership training. It's a program to kind of standardize the leadership somewhat. The employee climate survey, they are still very much engaged in reviewing the data, acknowledging what was said on the survey, and to just keep improving the climate, basically. New employees have meet the management team and meet the CEO now, and the last one was held August 26th. They're also reviewing health insurance options. The good news is the current health insurance provider came back with a 13% increase, which was less than what they did last year. And this is before we even asked or negotiated anything, but Andre and his team, they're still looking at other options. For information technology, AI, the Elios Health, that's the AI that helps with documenting patient visits and so forth. That's implemented to everybody but the medical side, I think, or something like that. So that's good. Facilities, the firewall and the signal testing was successful from the county, and we're converting from the county feed into the courthouse feed, and then I think we're done with fiber for now. It's a long. And sadly, the match room is sitting on a desk in the federal government somewhere because it's funded by a HRSA grant, which is federally funded. So until the government opens back up, we're just kind of in this holding pattern. So that's that. On to page 8, we have to pay the bills. And I recommend that the OnPoint board approve the September 2025 disbursements totaling $4,247,043.50.
I have support for that motion.
Support.
Support by Jessica. Any discussion? I'll just mention that Beth and I have both looked at that list and went, who gets $2 million? But it's a bunch of different vendors. It's not just one particular one. So, okay. No discussion on that, on paying it. So let me go through. Glenn,
Yes.
Jessica,
Yes.
Mark,
Yes.
Crystal,
Yes.
Gail,
Yes.
Beth,
Yes.
I say yes. Marcia,
Yes.
Jane,
Yes.
Deb,
Yes.
motion passes.
Okay, moving on to page 11, with some of the financials. And once again, this is, for August 31st of this year. The far right column, the Medicaid subtotal, the 1.27 million, that's the amount going back to the LRB. Obviously down under the CCDHC total, that's free and clear, and that's our money to use however we'd like to, or save it for a rainy day. One thing I do want to acknowledge is that we were behind in visits, and year-to-date visits are now over 26,000, and the year-to-date budgeted visits were at 25,300 roughly. So we exceeded the visits. Janine, very good. Year to date, we're over by 683 visits. So back on track, which is a good thing. Moving on to the next page. It's basically doing well. Yeah, I don't really think there's a whole lot to say other than going all the way down to the bottom to the unrestricted net position of 3.2 million. That's basically from the activity of the CCBHC. Moving on to 13. Let's see this. All right. We're at 91.67% of the year. And if you go to the far right column, Healthy Michigan capitation is at 101. That's simply because we didn't have as many disenrollments. So people stayed enrolled, or we had an increase in enrollment. The percentage rate below it, 92.35%. CCBHC capitation and supplement. They caught up. We're at 91% for the year. They're at 92%. So very, very well done. For total revenue, we're at 93.8. If you compare that to total expenses at 91.4, that's good management because you always want more revenue than expenses. And they're pretty solid for where the year is at. Individual expenses, supplies and materials at 99%. Some furniture was bought, but how all this grant money works, it wasn't operating money, but it's an operating expense until the grant money comes in. I got a thumbs up. That's good. And then 97% right below that for those provider network services, in hospital or inpatient placements, the costs just continue to rise. So that's the tough part. Going down to the bottom to the change in net position, the middle number, 924,105, that's year to date. Just a little FYI for the newbies, back in 2022 for the same month, we had a net position change of 112. So we have, I think, been working. I haven't. You guys have been working your tails off to have that kind of number. So kudos to OnPoint staff. And guess what? That concludes my report.
Questions for Beth? Thank you. And I know you didn't meet today, but anything for recipient rights to report?
We did not have anything to report.
I can look over at Kelsey too.
Yeah.
Okay.
But she's having meetings without me and not telling.
We don't want to, yeah. Is it Mary or Stephanie here
Yeah.
today?
Hi, good evening. You've got me.
Okay. would you like to
Right.
give us an update?
I would love to. I have 6 things to update you on. I promise I'll be brief, but I do want to let you know that we were able to extend contracts out to all of our providers. As you may know, our state did not have a budget, and so we did not actually get our budget and our contract until October 7th. So we were very late this year compared to normal, but we were able to get our contracts out for all of our grant projects, and the state did allow us to backdate those to October 1. So just wanted to let everyone know we did get those out last week. The other thing I wanted to mention to you is tomorrow is our board of directors meeting. We will not be having a work session. It's just strictly the board meeting, and it'll be at 1 o'clock. I will be presenting on our agency strategic plan, as well as just some updates that are going on in my particular department, which is operations. If you need a link because you want to watch the board via Zoom, please let me know. I'm happy to send that to you. Otherwise, we do have the meeting in Muskegon at Grand Valley, right on the waterfront. So basically right downtown. So that's tomorrow at 1. One of the other things that we have going on right now with the LRE is we did get back our report from Health Services Advisory Group. Sometimes you might hear us call it HSAG. I'm really pleased to announce that we got our final report and we got a 92%. So that's a really good grade. So we're very excited about that. Just have a couple areas there that we need to submit a corrective action plan to Health Services on. That's due on Halloween. So that actually is next week, Friday already. And for a reminder, for those of you who are curious what this group is, this is the group that monitors all of our managed care functions, and it's a 3-year cycle. So in 1 year, they take a look at half of the functions. The next year, they look at the second year, and then the third year, they come back and do corrective action plans. So we're starting the new cycle all over again with year 1. The other thing I wanted to mention is we are actively monitoring the RFP and the procurement and the litigation, and also trying to keep our staff motivated to stay and keeping, as up to date on that process as we possibly can right now at the LRE. So those are basically the big items that we've got going on right now. So I will pause to see if any of you have any questions or comments for me.
Any questions for Stephanie? Did a great job. I think we're all set.
Thank you.
All right. I just have a couple of things, items to share from Friday's executive committee meeting that we had. I'll just say I was relieved to hear that the state and federal news was either no change or not awful. So I figure that's kind of what the best we get these days. So, and I'm sure Mark will give us any new updates if there is any when he gives his report. And then I do want to say that, well, first I'll say, I remembered that we had wanted to have like a new organizational chart because there's been quite a bit of difference. And so sure enough, they put that together for us. And it sounds like it was quite a feat to fit it on one page. And so it's very small print, but I'm glad to have this just to have for reference. And Megan, you said everybody got that in their board packet.
Not in the packet, but all the members do have it.
Oh, okay, good enough. And then we did get to have a little bit of fun at the end of the executive committee meeting. We got to be the judges for the door decoration contest, and it was very hard to make a choice because they all were very, very good. A lot of wonderful creativity and artistic talent, and that was fun to see. And I kept mentioning that, I had walked around the building during the grand opening, but I hadn't seen anything since everybody has moved in and everything. So that was a nice, just little quick tour around to see what it looks like now. So. Any questions about the executive committee meeting? Oh, yes.
There must not have been a problem with the judging because there was no recall of the judge.
We would have given first prize to everybody.
No.
Most of us.
Most of them.
Okay. Mark, will you please share any items from your CEO report that you want to emphasize or update us with?
Move up here just to see folks easier. By the way, when we get done tonight, we're on a pace to get done super early, which seems like we're kind of on that unless you want to spend time grilling. We can take tours for anybody who's, hasn't seen it for a while. Be happy to do that. I was just say, some of the orientation happened not in person, so you're overdue.
Tour, I think.
Yeah,
we're
yeah.
great.
So,
We should
right.
take it.
So we'll be happy to show you around that meeting tonight if you'd like. I wanted to just, first of all, there was a question that came up in the finance committee about the distribution of that Elios tool to our staff. And so the answer to the question, which you didn't have in the room at the time, is in fact, it has been distributed to all the clinical staff who have, notes to billable notes to report, except for the medical team that we referred to earlier. So yes, it's been distributed to everybody. I wanted to mention that, just to brief the board, we had a little bit of a conversation about this with the executive committee on Friday too. Last Thursday, we had an incident in the lobby in which a person had a health incident and was incapacitated. And staff responded to that person. And that they're unfortunately, until the EMTs and the fire department arrived, but unfortunately that person passed away and was there in our lobby until they were able to be removed. So we had that very unfortunate situation happen. You say we did discuss that with the executive committee on Friday. And I think the questions they asked were the very ones that I'm assuming are in your mind too, which is that did our staff and did our organization do as much as we could to help the individual up? And I wanted to let you know that unquestionably, in the mind of the medical examiner here, all of that too, we did every level bit of good that we could to try to help revive the person, but that was just not possible. So in case you're here, I just wanted to be aware of that. So thank you. Secondly, just to kind of go through the report a little bit, there's been a few changes. Of course, we are at the point of the shutdown, federal shutdown, and you've heard already about how funds that we are on the brink of accessing from the HRSA grant to be able to pay for the construction project in the MAT room is on hold. We really need that last yes before we can proceed. So everybody's revved up and ready to go. Contractors ready to go. We're just waiting for that resolution to happen. I went to, it's not really on my report because it just happened yesterday, but I went to a presentation on state of I guess, health reform and what it means at this stage where we are at, where we're concerned about the loss of coverage and the restriction of benefits and all the things that are happening at the federal level related to Medicaid. And just want to remind you what I said last month is that unlike some states, Michigan's expansion of Medicaid to individuals who are simply poor and not poor and disabled, that poor population, and the allowing of people with more than poverty level income to buy health insurance from that exchange, that group of people are the people that we're largely most concerned about losing within the Michigan's population. There were 400,000 people expected to be added to Michigan's exchange through the expansion of Medicaid, and that number became more than 700,000. So it's really a large number of people we're talking about, and the revenue involved with those covered lives is substantial. The point of the presentation yesterday, which was several speakers, including a couple of CMH directors, but what was really interesting to listen to was the presentation by the Michigan Association of Health Plans, the organization that represents all 10 of the 11 Medicaid health plans that operate in the state of Michigan, 6 of which operate here in Alton County. And the statement was that their focus for the future is not on trying to change the past in terms of the bill that was adopted, HR 1, that made all of these changes, but now recognizing or shifting their focus to the fact that preserving coverage is the most important thing that they can do and that we can do to try to make sure that people who have coverage don't lose it unnecessarily. So, we have a person from DHHS that we contract with. We pay half of her salary for her to be on our staff full-time to help people with their enrollment, coverage, all of the things that are needed for them to maintain coverage. And the task, as they talked about yesterday, was that we really need to be on top of it when it comes to people's coverage, making sure that it's not lost. So we'll be working to try to make sure that we do what we can to make sure that people who are covered don't lose that coverage, because that's such a key in the environment going forward. And even though we serve only a small portion of those that are Medicaid eligible, it's still important that we do what we can, especially in the population we're serving, because often the needs are very, high need behavioral health services. So I just wanted to throw that in there. State budget was resolved, and that's nothing we need to mention too much here. I will spend a little bit more time than what Stephanie did on the state RFP. At the time I wrote the report, the result of the case had not been, the result of the lawsuit had not been issued. The judge who heard the case in the Court of Claims, Judge Christopher Yates, eventually came out with an opinion the day after the RFPs were due, in which he basically said, state, you do have a right to issue an RFP as you've issued it for PHP services throughout the state. And it sounded to me like, there wasn't an expectation from him as the judge that had to be limited to public entities. So basically gave the PHPs the right, or supported their right, to go ahead and issue the RFP. What he did say, though, is that you've got trouble coming because the managed care functions that CMHs and PHPs do today, the PHP of the future that the state put the bid out for would restrict the CMHs or any entity that they contract with from performing certain managed care functions. Well, the Michigan Mental Health Code defines certain functions that are managed care functions as belonging to CMHs. So he said, for example, provider network. We are entitled as a CMH under the Mental Health Code to build a provider network to meet the needs of our people. And the state issuing an RFP doesn't negate that clause, even though it conflicts with it now. So I think the message was that you've got a right to do what you're doing, but some of what you're up to is illegal. And he will eventually hear other arguments on that point later. Because the state moved the RFP out, that's been done. But it hasn't awarded a contract yet in violation of the code. So that's probably coming. Since the time Judge Yates ruled on that case, I know that there have been additional CMHs, 4 or 5, I don't know the exact number, I think it was that number, not including anybody from the LRE region, but 4 other CMHs that's filed suit specifically looking in the Court of Claims for a relief related to a claim that had to do with the mental health code violation. So that's been more focused on as a direct complaint now, and will also be heard by Judge Yates. So that's where we stand as of today. The RFP proceeds, but there's a clear hurdle ahead of them. So that. And then finally, on the back side on page 34, in addition to the lovely article about the Art of Recovery event, at the top, I talked about the My Plan that you authorized joining. There were 2 additional boards that chose to join the My Plan, which did submit a bid under the system to try to preserve a public entity. It was both Calhoun County, which is Summit Point CMH, and Berrien County, which is Riverwood Center. 2 other CMHs have joined the effort. So that's what we know as of now. And I think that's all I have for you, unless you have questions for me.
Questions for Mark?
Thank you.
We have another opportunity for public comment. Is there anyone who wishes to address the board about, thank you. What? Okay,
I just wanted to, give kudos to the team who put on the Art of Recovery event. It was largely led by all of our peers and they did a great job. We were, because that event took place in September, able to have a speaker come from HRSA. So we had a national speaker at that event, which is really exciting. So thank you to everybody. And then, I do just want to personally thank Rob for his leadership, with the, unfortunate incident we had on Thursday.
thank you. Anyone else?
I just wanted to mention that this Thursday, there's a Veterans Stand Down event, at the Baptist Church. And then, there is also a trunk or treat event that same night. OnPoint will be a part of both events
It's out 2 months.
by the health department.
The trunk or treat.
Trunk or treat event.
Anyone else? Okay, board member comments. Jessica?
Nothing, but would it be okay if next month, we all bring our, heated blankets?
Yeah.
Like, it wasn't so cold when we first started in here. They're cold. Other than that, no.
Want to announce that the EOC of Allegan County received a award, which OnPoint is part of that response team for our Palisades activities and drills, and for the proficiency and the level of professionalism that we were able to show and exercise. So kudos to OnPoint being part of that. So.
I also thank you.
Yeah, I just want to reiterate that, looking at the finances like 4 or 5 months ago and seeing us in the hole with the physics, coming out of that, it takes a huge team effort. And so thank you for working so hard out there. Not just Gina, but everybody else too. So,
That's the word.
yes.
Mark?
Just to piggyback on what Gail said, Sarah Clark received the award for Emergency Manager of the Year at the Safety Conference this last weekend. And then if anybody is having events around the county and would like to have someone there that is promoting gun safety, giving out child safety locks, the UCW, I think it's United Church of Wayland, gun prevention team. It has a program going. They've distributed 1,100 gun locks so far to prevent children from getting into guns. And I mentioned it at the seniors because a lot of us grandparents have guns, and we grew up where you didn't have to have all that gun safety. And so they're thinking about where that could be brought in. And so anybody needs to, Terry Whitley, former state police officer's wife, is kind of in charge of that for the Wayland area. So I'm sure you can contact UCW and get a hold of them. And I'm looking forward to attending the conference.
Crystal? No comment. Deb?
Thank you.
And that's Jean? No comment. What's that? And I have no comment either, except that, yes, I am gonna go to the conference too, and maybe there'll be a couple of fall color leaves still up there, you know, one year we went, it was peak, absolutely peak color, so. Okay. Our next board meeting is, November 18th. And I've already noted one, Or no,
I will be.
you'll be there for that, won't you?
I
Not
should
the,
be here for that.
okay, okay. Anybody want to give me a motion to adjourn?
Well, quick question before I do.
Okay.
Do we have to appoint any delegates to the
No.
conference?
There's no member assembly this year.
Okay. Vote to adjourn.
Support.
Favor say yes.
Yes.